Can see Mr. Umesh. I can see Miss Supali. Hi, Samuel sir. Good to see you all. We are just waiting for a couple of minutes more because I can see a lot of people are still joining in. I
Yeah, because
don't
it's a
want.
weekday,
Yeah, I
Friday.
know.
Okay, so before we move ahead with the main session, I just want to know quickly that who all are fasting and who all are very excited to to participate in the gut challenge. Good evening. I would like to know in the chat box who all are participating in the gut challenge tomorrow. It's a wonderful experience. If you go to Jindal or any of the naturopathy center, this entire 2 day course is for 50, 60,000. We are doing this, almost 5 days course, which is amazing and which is going to be rejuvenating for each one of you. I'm sure your body will show a gratitude towards you and you will experience the change once you experience it. So please do try this out. Please follow the entire plan, which is entitled to you. Anyone who has the HbA1c below 7, will be applicable for diet plan 1, and those who are with the complications on insulin will be applicable for diet plan 2. So follow what is applicable for you. So can we have some more energy? Can we start the session? Can we see the chat buzzing? Everyone? Okay. I hope everyone had the dinner. Can quickly write down in the chat. Everyone had their dinner. It's 8 o'clock. We all are having early dinner. Awesome. Some more heads up. I hope we all had our dinner. Quickly, Sandeep ji, great. Selena, great. Okay, many people have done their. Okay, 39 are here. So we will start, Ayushi. So I just want to quickly introduce Ayushi is our team lead here with us and handling a great, team of coaches and training them for their expertise. She is a senior coach and one of the best coach and the team lead we have. She has a great vast experience in the field of nutrition and has been working from last almost 6 years. And I just want to hand it over to Ayushi to give a walkthrough to her last experience where she has worked and what was her experience in this field. Please, Aishi, share it with everyone.
Sure. Thank you, Neha, for such wonderful words, firstly. Hi, everyone. As Neha said, I'm a team lead at SugarFit, handling, a team of coaches. I have been with SugarFit since a long, long time now, almost when they sort of began. I'm from Delhi. So if anyone is from Delhi, hi, I would love to see you in one of the user meet also, which will be planned soon, I hope, Neha. And yeah, I've been working for almost 9 years now. I have worked with Manipal Hospital. I have worked with Healthify Me. I have worked in many hospitals in Delhi. And yeah, now I'm with SugarFit. And I think all of us are here to sort of work on our health. And today is Women's Day. So that is, it's quite evident what will be the topic of today's presentation. Of course, we are going to talk about women health, but it's not only for women. All the men out there should also know, the basics of women health, because then I think it will get easier to understand your wife or or your better halves, right? It will be much easier to understand them, right? So yeah, I think without further ado, let's begin. I'll share my screen. Please let me know if you are able to see it. Uh,
Are you able to share, Aishi?
yeah, I'm just looking at it. Give me a minute. I am able to share. Yes. Yeah. Can you see my screen?
Yes, Aishi. It's visible.
Okay, I hope all of you can see my screen. Can you quickly give me a thumbs up? I hope there is no technical issue or error on anyone's end. Okay, perfect. So as I said that today's topic is going to be on women's health, and we are going to understand how a women's and a men's health is they are different, they are poles apart. And when we say that, we are specifically talking about hormones here, right? Because a female body and a male's body is totally different, and we all know why it is different. So all the female attendees here, have you ever felt any of these problems which are depicted on my screen? Do you feel tired throughout the day? Do you feel that there is nothing wrong, but you don't have the energy to even do the basic things? Or do you also feel that after menopause, the your energy levels and your enthusiasm is not that more? Has any one of you felt any of these symptoms? If you have, then please drop in the a yes or a thumbs up on the chat, right? So these the symptoms which are depicted on the screen, or the statements which are put on the screen, like I feel totally overwhelmed, there are sudden mood swings, I get very anxious and angry, before periods I have these PMS, bloating and brain fog, I don't feel like doing anything, I feel tired throughout the day. This, you are not alone here, right? And this is not only specific to you. This happens with each and every female at one point in their life. And the complexity of feeling in a certain way or going through certain symptoms, like maybe digestion, maybe frequent headaches, maybe not having those energy levels, or unexplained weight gain, is because of the hormones play in your body. We have so many hormones in our body, and for a female, their hormones change every week because of their menstruation cycle, right? So there are hormone changes happening every week, and that is why one week you would feel full of energy, on another week you'll feel totally dull, and that is completely normal. But what we need to understand is, we need to understand some symptoms which is not okay, like if you have frequent headaches, if you have frequent anxiety, if you have foggy thinking, if you have sleep problems, that means there is some imbalance among your hormones, right? So when we are saying hormones, but what do we exactly mean when we say hormones, right? Hormones are nothing but they are like small chemical messengers that actually involve a lot of body functions, right? And they are responsible for your weight, for your mood, for your appearance, for your energy, for your anxiety levels, and even for your fertility, right? And even a slight imbalance, मतलब कि अगर हॉर्मोन्स थोड़े से भी ऊपर नीचे हो, even a slight imbalance can actually lead you not feeling that well, or not feeling energetic, or maybe symptoms like acne, or maybe low libido, and frequent mood swings and anxiety, right? So although they are small chemical messengers, but even a small imbalance can actually make you feel very drained, very lethargic, right? But what do we need to understand about hormones? Firstly, we need to understand what are the major hormones that plays role in our overall metabolic health. Okay, and the first one of them is cortisol. How many of you have heard about cortisol? I think if you watch Instagram, if you watch YouTube, if you watch various if you read a lot, you might know about cortisol. And cortisol is most commonly called as stress hormone, right? If you would have a detailed discussion with your coach, I think आपके coach ने भी कहीं ना कहीं किसी point पे cortisol mention करा होगा. And for those of you who have high stress jobs and very hectic work schedule, this is something which is called as stress hormone, right? Cortisol is the primary stress hormone which is released when your body is stressed. Okay. Now, why we are talking about cortisol is because it is very much involved in our blood sugar, managing our blood sugar levels, our energy metabolism, our immunity, blood pressure, and overall central nervous system, right? So again, this is a very important hormone, and you need to understand that this is a primary stress hormone, right? The next hormone we are talking about is thyroid. I think a lot of you might have heard about thyroid. And we, in a very layman language, you'll say कि thyroid हो गया है, which is nothing but hypothyroid that we talk about, जहाँ पर the weight gain is there, the fatigue is there, not willing to get up, not willing to even walk is there, right? So thyroid hormone is actually very much involved in our metabolism, and it helps our body in utilizing the energy. When the thyroid hormone is less, that is the term which we call as hypothyroid. Hypothyroid, if you're diagnosed with hypothyroid, that means the thyroid gland is not producing enough hormone, which leads to weight gain, fatigue, low energy, difficulty in concentrating. And the next condition is hyperthyroid. That means the thyroid gland is producing a lot of hormone, thyroid hormone, and that leads to weight loss, anxiety, and then, you are very hyperactive, you can't sit at one place, all these things, right? So I'm pretty sure that some of you, many of you have heard about thyroid. You might know someone who's actually, diagnosed with hypothyroid, because it is getting very, very common. And this is also something which is totally the, play of hormones, right? Then the next is estrogen. Estrogen helps in regulating menstrual cycle of a woman, right? And it has a lot of major involvement also, because it is involved in bone formation, working with vitamin D, calcium, and other hormones, to break down and rebuild bones and according to body's natural processes. So what happens is, when your body reaches menopause, you all might know what is menopause. Menopause is when your body stops ovulating, and what happens is the estrogen level falls down. And because estrogen is very much involved in vitamin D, calcium, and all these uptake, because the level falls down, so a woman is, more prone to bone loss after menopause, right? And that is why postmenopausal women are 4 times most likely to suffer from osteoporosis as compared to men, because body stops producing estrogen, or the estrogen level declines, right? And that is why we always say that, for women who are above 40-year-old, they should actually take care of their vitamin D, their calcium. They should get their levels checked every 6 months. If there are any deficiency, they should take supplementation for the same, right? Because you are at 4 times more, you are at risk of 4 times more than compared to men. And the osteoporosis, it's a, irreversible condition, so it's better to plan it ahead rather than be sorry later, right? Then we have progesterone. Progesterone is a hormone that is, usually, it reaches peak during pregnancy and lactation phase. But again, this is also a very important hormone. And progesterone deficiency is the number 1 hormone imbalance in women between age to 30 and 50, right? And because of this deficiency, the major symptoms like anxiety, bloating, fatigue, irregular periods, PCOD, hot flashes, lack of sleep happens, right? So, why we are talking about these hormones? We have talked about 4 hormones, right? Cortisol, estrogen, progesterone, and thyroid. Why we are talking about these 4 hormones? Because these are very important in a woman's health, and to maintain their metabolic health also. Why these are important? Because even a slight imbalance, as I said, will lead to you feeling very drained, very lack of energy, and then eventually this is going to impact your lifestyle. So whenever you feel like you don't feel like exercising, maybe that has a deeper connect to your hormones, and it's not only because of laziness or lethargy, right? But what actually causes this hormonal imbalance? What is the what are the prime 4 factors which causes this hormonal imbalance? The first one is the usual changes in your lifestyle phase, wherein the puberty hits, and then the pregnancy, and then the menopause. Because of these shifts during aging, there is a great I would say turn of hormones. In pregnancy, the progesterone level will go high. In menopause, the estrogen will go low. So that is the usual natural cycle wherein we don't have much control. But another most important factor is stress, right? As I said that, whenever you are stressed, the one hormone which get released is cortisol, right? And what happens is, if the stress levels are not taken care of, if you are no, if you are constantly stressed, and you are not really able to manage your stress levels, then the body will also start producing using progesterone to make more cortisol, right? So as a result, what will happen is, your body will use the progesterone to make cortisol, and body will get deficient in progesterone, and again the symptoms associated with low progesterone, which is anxiety, mood swings, will come in play, right? Will lead to hormonal imbalance. The third one is your diet, right? So diet, you might all know very well from now, or till now, and your coach must have been guiding you well also, that diet is actually 60 to 70% is the role of diet in your metabolic health. We say what you eat is what you are, right? So this is also true when it comes to hormonal imbalance. If we are eating food that spikes insulin, that is going to cause hormonal imbalance, because insulin is also a hormone only, right? And sometimes, like, you might have read about a lot of articles wherein they say that now the foods also contain hormones, right? Some, there are some practices in which they ingest hormones into certain foods to either, make them more perishable, to increase the shelf life, and that we are directly consuming, which can again lead to hormonal imbalance. But the majority of the chunk is, if we don't eat balanced meal, if our insulin spikes, that will lead to further hormonal imbalance, and that is really not going to help us. So it's not even about managing diabetes. We don't say that, okay, you have to eat a certain type of diet to manage your sugar levels. It's not, I'm not even talking about diabetics here. What I'm talking about is, eating healthy is the very basic thing that a person should do, irrespective of them being a diabetic, being a heart patient, or being a thyroid patient, right? And this is a lifestyle change that we need to bring in. There is no diabetic diet, there is no, there's no CVD diet, cardiovascular diet. There is only a balanced diet concept that a person should bring in their lifestyle to actually stay healthy throughout the life. Then the fourth one, and the most often ignored ones, is lack of sleep. I know all you, women out there, those who have kids, you will wind up your work late in the evening. Then you have to wake up in the morning because kids have to go to school, or you have to go to work, or, of course, you have certain home duties also. It's like doing two jobs together. You are looking after your kids, and then you have your own thing, or even, females who are housewives also. I think it's too much work, right? You have to look after the kids, you have to look after the house, you have to look after everyone, right? And in this practice, you are often ignoring yourself, right? So you are going to bed late, and then you are waking up early, and then you're not getting enough sleep. And what is that doing is, that is actually causing the further hormonal imbalance, right? Your stress hormones will be increasing, and then you will be sleep deprived, and that will further increase the cortisol in the morning. So it's not really going to help you, right? And the fifth one is the medication. Now, of course, we cannot avoid medication if we are not keeping well. But sometimes, overuse of medication. For example, sir dard ho raha hai, to you will take one pill, or you are not feeling well, you are feeling a little cold and congestion. If you are taking antibiotics without prescription of doctor, that is not good. If you have taken steroids That is also not good. Of course, if the medical thing, of course, prescribes it, we don't have much control. But what I'm trying to say here is the contraceptive pills, the hormone drugs, the steroids, antibiotics will have an impact on your hormones, which will last. It is going to last not for 1 or 2 days, but it is going to last for weeks. Right? So we have to be very cautious about what medicine we are taking. We should not take medicine. We should not take medicine by ourselves. Should always consult a doctor before going for that strip of antibiotics, or maybe, any painkillers also. Okay. So the major, a chunk of this whole session is actually around the lifestyle practices, right? And what we see is that, we often ignore ourselves, and we have to, because we have to, look after 100 things. And what is happening is we are stressed, we are sleep deprived, and we are not eating enough. How many of you ensure that you eat at least 10 grams of protein in every meal? How many women are there who would eat eggs daily, or who are taking protein supplement if you are a vegetarian, right? I hardly believe there will be some. Most of our diet will be roti, sabzi, or maybe rice and some curry along, right? But is that giving you sufficient nutrients to function so vigorously throughout the day, right? That is the whole agenda behind it. That we our bodies are overworked, they are stressed, and the rest is not there, and as a result, all those symptoms that we talked about in the beginning is coming, right? So now let's talk about how to balance it out, right? It's no rocket science. I'm not talking about anything different here. As I said, you all know about this, and there is nothing new about it, but the basic concept remains the same, which is a balanced diet. If we talk about diet, it has to be a balanced diet. No crash dieting, no fat diets, nothing at all, but just balanced diet wherein 50% of your plate is vegetables, one fourth is protein, and the remaining is a complex carb. If you eat this way, you don't have to count calories, you don't have to weigh your food, and this will help in, it will ensure that your body is getting adequate nutrients also. Right? Moving on, of course, apart from diet, there are some supplementation which can also help a woman, for specifically for postmenopausal women. Erythros primus oil, estrogen supplements are provided to balance out the hormones and to reduce the symptoms of hot flashes, anxiety, and mood swings. Apart from this, please always check on your vitamin D and calcium levels. And if you are deficient, of course, that will require supplementation. Omega-3 foods, either if you can include it from the diet, well and good enough. If you cannot, then please reach out to your health practitioner or your doctor to provide you with the appropriate supplementation. Vitamin B, as I said, vitamin B is very much involved in your carbohydrate metabolism. And if you are deficient in vitamin B12, if you guys are vegetarians, definitely you will be deficient in vitamin B12, right? Again, the supplementation is the only answer. No food for a vegetarian will provide you vitamin B12, right? So it's very important to add supplements specifically for postmenopausal women. As I said, there are 2-3 supplements: vitamin D, calcium, and estrogen supplements, which should be, on your list. But yes, it's better to always discuss with the doctor and then probably add it. Then comes exercising. So why this is important is because our bone density is increasing year by year as we are aging, and only exercise will ensure that we have a good muscle mass. So what should be your target is weekly, at least 2 to 3 times, you should actually focus on strength conditioning, which will help in making your muscles stronger. And specifically for women aged 30 and above, it is very important that you start with strength and conditioning. It is high time that we say, it's a common notion that weights are only for men. Men should lift weights, but it's actually not true. Women need to lift weights more as compared to men, because men naturally have higher muscle mass. Women don't have a higher muscle mass, and our muscles are going to become weak over a period of time. So we should start lifting weights and ensure that at least 3 times in a week we are exercising, right? And then of course, apart from that, the rest of the 3 days in a week, you can stick to your walking, you can stick to running, you can stick to yoga. But yes, please start lifting weights. We have our live strength and conditioning session every morning and evening. If you want, you can take help from there, or go to a gym, or probably, any reach out to your coach. They will provide you a suitable strength and conditioning video to start. Then, of course, let's just talk about sleep hygiene. If you are doing a diet, if you are doing exercise, but you are not sleeping, then the diet and exercise will not help. Mark my words, you can do any type of diet, you can do any type of exercise, but if your body is sleep deprived, you will not see weight loss, you will not see changes in your sugar levels, because that is the core reason behind hormonal imbalance, right? So first, fix up your sleep. How to fix up your sleep is, screen time is very common nowadays. We are always on our phone, even on our bed, we are on phone scrolling through reels, going through YouTube. But what that is doing is that is decreasing melatonin. And as a result, our sleep quality and duration is impaired. So please make it a point not to use any gadgets at least 1 to 2 hours prior to your sleep time. Make sure that you eat your dinner early, because if you are eating dinner late, then of course your sleep, again, because your digestive system is up, and if you are trying to sleep, the sleep quality will be poor, right? Create a soothing environment. Try and go to bed at the same time every day and wake up at the same time. Set your body in a circadian rhythm, right? If you are going to bed at one day at 1 a.m. and another day at, say, 10 p.m., it's not really going to help, because your body is not really able to maintain a cycle there. So it's very important for your body to stay in a cycle and maintain circadian rhythm, right? So please ensure that you're sleeping more or less at a similar time. And one most important thing is avoiding caffeine. I know we all need our, evening chai and coffee. I understand that. But if you're taking it after, say, 5 p.m., caffeine stays in your system for 4 to 5 hours, and it is going to disrupt your sleep. Try and take your evening tea or coffee by 5 p.m. maximum, not later than that. Let's not, continue with the habit of taking tea, coffee after dinner, or along with dinner, or maybe late in the evening. Trust me, it's not going to help you at all. Right? Yeah, and I think that's the gist of it. As I said, you most of things we know what needs to be done, but it's all about implementing a healthy lifestyle which will help us. And as I said, it's not only for diabetics. Any individual who would want to stay healthy for say, next 20 years, they should start incorporating these practices in their daily routine. Any questions that I can take?
Thank you so much, Aisha. I think it was a very short, crisp, and to the point webinar. Very well explained by you. I hope everyone can understand. So, along with this, we can also do the seed cycling, where we can outsource the estrogen and progesterone. I will share the picture with you for these in the first 14 days. From the first day of your cycle, you can start with flax seeds and pumpkin seeds. And after 14 days, you can start with sunflower and sesame seeds. To memorize it easily, we can add it up. I will share the pictures of that. I think after seeing the picture, it will give you more clarity and you can easily memorize it. If you have any question related to the webinar, Aisha is all open for the questions you can ask. Thank you, Pratibha ji. Pratibha ji is saying, thank you for wonderful webinar. I have a little bit clarity about hormones now. We are glad we could address your concerns. And it is a concern not for just women, but again, everyone is impacted, even even a men, a husband, a father, everyone gets impacted because somewhere these hormones plays a very important role, and this leads to the mood fluctuations in a woman. And nobody can understand. They feel that the woman is very, picky and always, not happy, or always, somewhere making a lot of faces, or going through a lot of mood swings. But then again, it's not about just the mood swings. It's a has to play a very important role, even it's for a teenager or for a woman in a normal phase before premenopause or after menopause. Every woman goes through a lot of ups and downs in hormones, even during the pregnancy. So please understand and support your, family members, especially the women. Uh, all the men are requested to support them, understand their condition, what they are going through. And if they do the seed cycling, if they take good care of themselves, if you can understand and give them a, open ears, I'm sure we can resolve most of the problems and the conflicts that occurs very often at home. And this will definitely bring more peace and more prosperity in our life. So please do take care of it. And actually, we don't have any question. It was so well explained. I think it was all clear. Thank you so much, Aishu, for joining us today and taking this wonderful session on the eve of Women's Day. So thanks a lot for making all the time. I know you were not well, but still made out of that time for it. Thanks everyone for joining, and we will be taking the questions on the gut now. So if you have any questions, I hope you all have gone through the entire diet plan for the date one. I have not given the diet plan for the entire 5 days because it will be very difficult for you to understand them. It will create a lot of confusion. So what I have done is I have given a diet plan for a day one for the users with complication and without complications. Now, what is complications here? Anyone has HbA1c above 7 will be on a heavy dose of diabetic medication. So we cannot do a very strict diet there. People can be on insulin, people can have many other multiple other ailments. तो वहां पर हमें बहुत ध्यान रखना पड़ता है, ठीक है? So it's a very simple diet where we are adding a lot of food which is gut friendly. And if we just take care of the gut friendly food for our gut, feeding it right with the right microorganisms and the bacteria, it will help us in flourishing it better. हमारा इम्यून सिस्टम अच्छा होता है, वेट लॉस भी अच्छे से होता है, हमारी जो बॉडी में इतनी सारी रेजिस्टेंस होती है जिसकी वजह से डायबिटीज हो रही है, ब्लड शुगर कम नहीं हो रहे, that also comes down very easily. So this entire 5 days plan is divided into 5 different detox of organs. Number one is day one and day two, Saturday and Sunday, we are doing the colon cleansing. We are cleansing our colon. हम जब खाना खाते हैं सारा वेस्ट कहाँ जाता है? कोलोन में जाता है. So हमारे कोलोन की स्किन में ये सारा वेस्ट प्रोडक्ट्स इकट्ठा हो जाता है. इसको साफ करने के लिए what we do the colon cleansing. So day one, day two is a colon cleansing. Day three is a kidney cleansing. After cleansing the colon, any cleanse starts with the colon cleansing. And then it goes to the kidney cleanse. After doing the kidney cleanse, we will move to the liver. And then at the end, we will be getting back to the routine. Day 5 is a very normal, but then this is very important to make that shift back to the usual meals. अगर हमने एकदम से बहुत सारा heavy खाना खा लिया day 5 पे, what will happen? You will feel sluggish again. तो जितनी मेहनत करी सब बेकार. तो हमें क्या करना है? We have to follow the diet as it is. If you are somewhere feeling hungry, salads are absolutely okay. Fruits are okay. Have the fruit, have the salads. Try more on the salads. Coconut water ले लीजिए. There are a couple of combined questions which has been asked. I will share with each one of you. But apart from that, if there is any concerns and questions related to the diet plan, please go ahead and ask me. I'm open for the questions on the gut health. And I will also brief you about the entire plan. Give a second, I will share my screen. So if you can see here, this is the plan for day one. For people, so first we will take up the plan which is for people who have HbA1c below 7. जिसका भी HbA1c 7 से नीचे है ये उनके लिए है, ठीक है? We can skip the medications because यहाँ पे अगर आप medicines ले रहे हैं तो आप छोड़ सकते हैं उस दिन because we are not eating more carbohydrates. Those who are not on medications need not to worry, can do it very freely, ठीक है? So those who are having HbA1c below 7, can do this. How we have to start the day? First thing, we have to keep sipping the cardamom water throughout the day in the day one. Cardamom water कैसे बनाना है? 7-8 cardamom लेंगे, इलायची लेंगे, 1 to 2 liters वाटर में अच्छे से उसको बॉईल कर देंगे आज रात में और उसको रात भर सोक करके रख देंगे. कल सुबह से हम उसे थोड़ा थोड़ा करके पीना शुरू करेंगे. तो जैसे ही आप उठते हैं तो सबसे पहले क्या करना है? 1 से 2 ग्लास 1 to 2 glasses ऑफ कार्डेमम वाटर हमें लेना है. उसके साथ अच्छे से च्यू करके आलमंड्स खाने हैं सोक करे हुए, 5 कैश्यूज खाना है और एक अंजीर खा सकते हैं. अंजीर है तो ठीक है, नहीं है तो कोई बात नहीं. इवन आपके पास अगर रेजन्स हैं, किशमिश है, तो 2-3 रेजन्स आप ले सकते हैं. ठीक है. दिस इज फॉर द डे 1. सुबह उठते ही 2 ग्लास कार्डेमम का वाटर एंड देन वी हैव टू टेक द soaked almonds, cashew, and anjeer. What is more important? Chewing the food. How the digestion starts? Starts in the mouth itself. So we have to start digesting and chewing the food well from the beginning itself. So पूरा focus कल क्या रहेगा? We are chewing well. अगर हम chew नहीं करते हैं तो क्या होता है? Lot of bloating happens, lot of indigestion takes place, and lot of fat accumulation takes place. After that, we can do any of the light workout. So anyone who is not on medications can easily do any workout. If you have the energy, do it, go ahead. But otherwise, if you feel, no, I won't be able to survive or it's just the day 1, go with the yoga. You can join Pooja's class. It's a light yoga class. You can do light, walking. You can go for a walk. You can do any of the light stretches. Anything which is comfortable, you can do that. Just the thing is, keep moving throughout the day. Next thing what we do, after that, we eat an apple. Apple may we have melon, which helps in opening up pores of the colon so that all the toxins will get released and it can easily be flushed out through the system. So what we observe in the first 2 days during colon cleanse, 2-3 loose motions, or there will be more motions compared to the usual days. रोज हम एक बार जाते हैं अगर तो for the colon cleansing days, we can go 2 times or 3 times, which is very normal because we are cleansing up the system. Okay. So first chew the apple thoroughly. After that, we have to take the concoction. At least 15 to 30 minutes ka gap dena hai. In that concoction, what we have to take? 150 ml of water. In that, 2 teaspoons of sea salt, Himalayan pink salt, kala namak, सेंधा नमक डालना है. नॉर्मल सॉल्ट नहीं डालना है, उसमें सोडियम होता है बहुत ज्यादा. What we are taking? Himalayan pink salt. We are taking the सेंधा नमक, or we can go with any of the low sodium salt. Then 2 teaspoon of lemon juice. 2 teaspoon जो हमारा normal teaspoon होता है lemon juice लेना है. 2 teaspoon of ginger juice. Ginger को grate करके you can squeeze it and then put it there in the glass and mix it well till the entire concoction get dissolved. Pura mix ho jayega, and then keep sipping it well. So this will help again in cleansing your intestinal wall, colon, as well as the entire digestive system so that we can get rid of these toxins. अगर ये toxins हमारे intestine की और colon की skin पे रहते हैं, तो what happens? It keeps eating the colon lining and the intestine lining, making it permeable to the toxins which is there present in our bloodstream. So we have to cleanse the system. We have to make the body more cleanness. The impact will be visible on your skin, will be visible on your number of readings. Aap readings लीजिएगा, देखिएगा, your readings will come down drastically. So please do that. So what we are doing for the lunch, either you have the 1 full bowl of sorted vegetables. So we can go with this size of bowl. If you can see, this is the bowl size. अच्छे से भर के we can have the sorted vegetables here, and teaspoon I'm talking about. So this is the teaspoon जो हम खाना खाने के लिए use करते हैं. So this is a teaspoon which you can use. So we can take sorted vegetables, 1 bowl, and we can take the kombucha. Now people say that we don't have the kombucha, we can take the beetroot kanji. If we don't have the beetroot kanji, we can take the rice kanji. वो भी नहीं है तो thin buttermilk, 2 teaspoon of curd in 1 glass of water. Mix it well, add the sea salt or the black salt, and you can just either add the chia seeds or just drink it like that. Mix it well and drink it. So either we can take that, or we can drink the rasam. Those who are in south can drink the rasam, but spicy kuch nahi banana hai. The moment we make everything very spicy, it makes the body very acidic. The entire detox is gone. Jitna spicy खाएंगे, body will become utna zyada acidic. So please, we have to remember, don't add red chili, green chili to your meals for the next 5 days. Let the body cleanse, let the blood have more alkalinity. So this is the lunch for the people who have HbA1c below 7. Next for the evening, you can have the papaya. So you can see the difference. You can adjust the timings accordingly. 12 to 1 is your lunch, then 3 p.m. close to 3:30, we can have the papaya, one bowl of papaya. We can have the seeds before that. 2 tablespoons of seeds can be taken, stew it, and we can have the beetroot kanji. Here we are not taking any tea or coffee because that makes the body more acidic and sluggish. We can have the lukewarm water if you feel the urge of having tea or something hot. We can take the green tea, but best to have the beetroot kanji, to have the kombucha, to have any of the rasam and all, which are again a probiotic. Vegetable soups can be taken at the night. You can add 3 teaspoon or tablespoon of quinoa. बड़े 3 चम्मच quinoa उसमें डाल के अच्छे से you can boil it, and that will give you more better satiety value. Add lot of vegetables to your soup bowl. Again, there is it's absolutely okay. You can have a big bowl. Abhi सबसे important. If at night, if you are not on medication, nothing need to worry. Keep sipping the cardamom water throughout the day. गर्म करके ले सकते हैं, नॉर्मल टेम्परेचर पे ले सकते हैं. अगर बाय चांस यू फील कि हमें भूख बहुत ज्यादा लग रही है, तो हैव द क्यूकम्बर, हैव एनी सैलेड, वेजिटेबल्स, और वी कैन have the handful of makhana, fox nuts, and we can have the lotus seeds, that what we call it, and 7 soaked almonds. ठीक है? रात में सोने से पहले, if you are very very hungry, try not to eat it. But if you can't resist, can take a small, bedtime snacks. Now, what is very important when we are doing the colon cleansing? हमारे body के, हमारे stomach के muscles को we have to stimulate. So what we need to do for stimulation? We have to, for the stimulation, we have to 1 second. So we have to massage the, your gut linings. How we can massage? I have one video. Either you can take the massage or you get the Epsom salt from any medical shop. बहुत सस्ता आता है. 20 rupees के छोटे-छोटे packs आते हैं pink color के. You can take that. या एक बड़ा पैक ले लीजिए. That is hardly 100 rupees, which is having a 500 grams of Epsom salt. So 1 teaspoon आप डालिए अपने bucket में, water में, एक पानी की बाल्टी लीजिए, पूरी bucket of water, and add 1 teaspoon to 2 teaspoon of Epsom salt. Mix it well and take bath before the bedtime, and that will help you. What is this Epsom salt? It is magnesium sulfate. So the moment you will add the magnesium sulfate to your water bucket, it will get absorbed well from the body. It will help in removing all the toxins which is there on the top of the layer, inside. Even किसी को भी internal body pain है, those who get arthritis, those who have lot of body aches, this will help in relaxing your muscles, and immediately you will get a very good relief after that. So please do that. And after that, drinking a 1 glass of water is very important because it is removing the toxins. It is also dehydrating the body for some extent. So it's important. Epsom salt ke baad, you have to take a glass of water. Am I clear? Any doubt? Quantity of Epsom salt, 1 to 2 teaspoons. What is kombucha? Kombucha is a sort of tea which is fermented, and then we drink it, and it's a very good, it has all the bacteria and the cultures which are gut required. What is kanji? Beetroot और carrot को हम mustard seeds के साथ water में boil करते हैं, and that turns tangy after 1 or 2 days. That's why I shared the guidelines long back, and then it helps in fixing your gut. Okay, so this is for the users who are having HbA1c below 7. Now the second version is for the people who have the HbA1c above 7. जिनको इंसुलिन पे हैं, जो बहुत ज्यादा मेडिसिन ले रहे हैं, so they will be keep on eating something. You can avoid The glimepirides, अगर आप glimepiride ले रहे हैं तो you can stop, you can avoid the sulfonylureas, okay, and you can reduce it to half because we are on detoxification. We can reduce the medication, diabetes medications to half. Process is same, cardamom water in the morning. After that, we are taking the almonds, cashew. We are doing a very light workout, no strength training. Please, आप अगर strength training कर रहे हैं, light करिएगा, don't exert yourself. And after that, again, apple, this will be the process of cleansing. खाली पेट करने से ज़्यादा effective होता है. And then after 1 hour of concoction, we can have the vegetable poha. I have given the people who are on insulin, who are on heavy dose of medication, can have the vegetable poha. If you don't have the very heavy dose of medications, you can go without poha also, and sorted vegetables can be consumed. You can add the boiled peanuts instead of the fried peanuts, and you can take a thin buttermilk along. So please, those who are on insulin, you know very well how to fix and adjust your insulin dose. Please adjust it accordingly. Rest of the people, once again. So my my detox started today itself. So today was Shivratri. I have started the first day of detox today. Tomorrow, and I did the water fasting today. So tomorrow I will be starting same along with you with the version 1. So this mid-morning, we have to take the chopped cucumber. You can take the seeds along. You can add some pieces of apple or some fruit also, or the pomegranate if you are feeling low. Next for the lunch, 1 katori sambar. Again, spicy nahi hona hai. Even the North Indians or any, people who are there in any part of the India, we have to go with the fermented food. Jo Gujarati hai, they can go with the besan, but again, besan will create more gas. So I don't suggest that. The best food is either go with the sambar and idli and sorted vegetables. Again, you can have the buttermilk or the beetroot kanji. So please stick to the sambar and sorted vegetables and idli. Start with sorted vegetables, very lightly blanch and then sorted in oil, very little oil. 2 pieces of idli can be taken and sambar can be taken along. अगर बहुत सिंपल करना है तो बिल्कुल हम खिचड़ी ले सकते हैं, मूंग दाल और थोड़ा सा राइस डाल के खिचड़ी ले सकते हैं. That is also okay. What we are doing, we are fixing gut. So please keep this in mind. Secondly, papaya लेना है 1 bowl, a nice 1 bowl of papaya, almost 1.5 कटोरी होता है. 2 tablespoons of seeds लेनी है उसके साथ. Again, kanji, or you can take the green tea. I hope it is clear. Night में we are taking soup. Again, soup here, but instead of 2-3 teaspoon of quinoa, हम यहाँ half कटोरी quinoa उसमें डाल रहे हैं for the complicated users, because they will end up getting the hypoglycemia. Then post dinner, you have to again keep sipping the concoction so that you can keep flushing the toxins. Urination ज़्यादा होता है, कोई बात नहीं है. आपके body में से glucose utilize हो रहा है, so that's okay. Okay, even आपके blood sugar हो सकता है बहुत ज़्यादा भी बढ़े. It increases in the cases when we have too much of glucose in the body, and when we do our fasting, body release that in glucose to help the system to do the normal day-to-day work. So body में बहुत स्टोर है, 6 दिन भी नहीं खाएंगे, कुछ नहीं खाएंगे तो भी चल जाएगी, but don't get panicked, ऐसा normal है. Headache होना normal है, we can get the headache, so please stay hydrated. There can be a bit of nausea, ऐसा लग सकता है, it's not sure, depend करता है person to person, so don't need to worry. Any one day of the detox, take the steam bath नहीं ले पाते, massage and steam throughout the session अगर हम एक दिन ले सकते हैं, like Saturday, Sunday मैंने इसीलिए choose किया था. Saturday we can take 1 day steam, second day we can take the massage, okay, and then you can keep taking the bath for next 3 days with the Epsom salt. But it's completely up to you. Very good detox massage to open up the knots. हमारे body में pain क्यों होता है? Because there are a lot of knots inside. Stiffness लगती है ना, we feel stiffness in our elbow, we feel the stiffness in our neck. क्यों लगता है? Because there are a lot of knots. उन knots को खोलने के लिए, pain को release करने के लिए, we do the massage. That also helps in stimulating the peristaltic movements of the gut so that it can cleanse nicely and detoxify our system. Bedtime again, आप मेडिटेशन करिए, वेरी इंपॉर्टेंट टू डू द मेडिटेशन. 5 मिनट करिए, 4 मिनट करिए, डू द भ्रमरी. आप अपने बस कान को बंद करिए, 2 fingers on your eyes, 1 on your forehead, and you have to just make the hum sound. It's a very relaxing therapy. It will help you in sleeping. It will help you in bringing all your chakras in balance. And make sure your back is straight. You are either sitting on the chair if you are old, or you are sitting in a folded legs position. Bedtime snacks, if you're feeling your HbA1c, your blood sugar is below 90, please ensure that you are taking the your handful of makhana or the soaked almonds. Now here, with the complicated users or the users on insulin, can experience hypoglycemia. Experience here, immediately check your blood sugar reading so that you don't let it go below 90. Immediately take the sugar. 15 grams of sugar ले लीजिए, नहीं तो 2-4 dates खा लीजिए, raisins खा लीजिए. After 15 minutes, again check your blood sugar readings. If it is coming back to 100, absolutely okay, no need to repeat anything. अगर लेकिन तब भी 90 से कम लगती है, we can repeat the process again. आपके medication जो doses जो रात के हैं, glimepiride वगैरह, please मत लीजिएगा, because we are taking only the soup at night. So please अपने insulin है तो reduce it to almost half, and no glimepiride, no sulfonylureas at the night time. Night में हम कुछ ज़्यादा नहीं खा रहे, carbohydrates बहुत कम है. We can have the less medication, or we can skip the medication for the night. Lunch की ले सकते हैं, breakfast के पहले की ले सकते हैं, because we are adding the poha. But dinner की we can completely skip the diabetes medication. I hope I'm clear. Are you all able to understand? This is the main, and I was asked a couple of questions. Can you give an option for beetroot kanji? So we can replace it with the rice kanji, rasam. Spicy नहीं होनी चाहिए, please keep it in mind. Kombucha या फिर बहुत पतला सा thin buttermilk बना के लेना चाहिए. Or when we are doing this gut cleansing, do we have to take diabetes medicine? So I tell you that if you have HbA1c below 7, don't take your medication. If you are on insulin, reduce the insulin dosage. And if you are, because you are eating the light dinner, please skip the medicines at the night time. Diabetes medicine should not be consumed. As we are just taking soup, it will not give any spike. How to take steam or massage therapy? Steam massage therapy can be gone to any, we can go to any massage center and get it done. Or we can call the urban clap, person at home, and they can do the massage. 5 दिन में एक बार भी लेंगे चलेगा, but once in 5 days. And rest of the days, there is a link I will share on the chat. You can follow this link to do the massage. And there are very few movements of the belly massage, which helps in opening up the knots and helps in improving your blood circulation. So this entire process of cleansing is very good for increasing your blood circulation in the body. हमारे body में blood में बहुत सारे depositions हो जाते हैं calcium के, toxins के. To cleanse the entire blood circulation, keep the heart healthy, this cleansing process is very good, and massage helps in enhancing the movements, the flow of your blood, and that movements and the massage helps in throwing and flushing out all the toxins. अगर किसी को quinoa अच्छा नहीं लगता है, can replace it with the steel cut or the rolled oats. No masala oats, packed with preservatives. For these days, no, packed food, please बिल्कुल भी biscuits, नमकीन ये सब बिल्कुल नहीं लेना है, cleansing नहीं होती है. We can go with the foxtail millet, kodu millet, whatever you have, any sort of millet, jawar millet can be taken in the soup, or we can take the khichdi if we are not able to bear the hunger. Please keep on writing me. I will send you my email ID also. जो भी रहेगा, you can just post me and even reach out to your coach. Now I am open for questions. Could be questions, Sam. Please go ahead and ask. Sharing the recipes here in the chat also. So recipes you can download. All the recipes are there. बहुत simple हैं. चाहे जीरा water बना रहे हैं, अजवाइन water बना रहे हैं. 2 liters of water, 1 to 2 teaspoons of fennel seeds, or 5 to 6 cardamom. Just add to the water, boil it nicely. Let it soak overnight. Let it get infused nicely, and day after tomorrow, you can keep sipping it from the morning. Any doubt? Yeah, Meenakshi, 1 second, I will unmute you. Yes, Meenakshi, go ahead.
हेलो
Hygiene.
ये अभी जो रात को हम बना रहे हैं वाटर, इलायची और जीरा दोनों डालना है उसमें?
नहीं, हर दिन का अलग लिखा है, बिकॉज नेक्स्ट 2 days हम क्या ले रहे हैं, कार्डिमम वाटर। तो
नहीं,
5-6
मैं आज से शुरू हो गया, कल से शुरू हो गया? ये
कल से शुरू होगा।
कल
अभी
से शुरू होगा।
में मीटिंग कराना, अभी सारा ब्रीफ करेंगे, फिर कल से शुरू करेंगे, है ना?
ओके, फिर
तो
आज रात को मैं इलायची का वाटर बना के रखूं?
कल भी लेना है इलायची वाटर, परसों भी लेना है, मैं पूरा आपको भेज दूंगी। इट्स वेरी
ओके।
सिंपल, रात में 2 मिनट का काम है। इलायची
हाँ,
बॉईल कर लीजिए। इफ यू आर
हाँ,
मेकिंग द कार्डेमम वाटर फॉर द रेस्ट ऑफ द डेज, उसको भी
ठीक है।
वोंट बॉईल, अगर हम सिर्फ सोक करके भी रख देंगे रात भर तो उसका इन्फ्यूजन हो जाता है। बस इलायची को इट्स बेटर टू क्रश सो दैट इट विल रिलीज इट्स कंपाउंड्स एंड गेट
ओके,
इन्फ्यूज्ड। इलायची
फिर
में
वो
बहुत सारा मैग्नीशियम होता है व्हिच
हाँ,
कीप्स आवर बॉडी एल्कलाइन।
अच्छा, उसको सुबह ही खत्म करना है या दिन भर लेना है थोड़ा
पूरे
थोड़ा?
दिन पीते रहिए, बना के रख लीजिए। लाइक जैसे मैंने आज सौंफ का पानी बनाया था, आई एम सिपिंग इट थ्रू आउट द डे। ये 3rd बॉटल है, तो खत्म हो गया था, फिर मैंने वापस से उसी में पानी और भर दिया।
सौंफ सौंफ डाल के बनाया उसमें?
मैंने
ओके।
सौंफ डाल के बनाया था आज। आई मेक एवरी डे डिफरेंट इन्फ्यूज वाटर, सो यू कैन
ओके,
टेक दैट कॉल।
सब्जा सीड भी डाल सकते हैं ना वाटर में, अगर हमें भूख लग रही है या कुछ ऐसा पीना है लग रहा है तो?
बिल्कुल डाल
सब
सकते हैं, कोई प्रॉब्लम नहीं है। इनफैक्ट कभी ऐसे लगे कि बहुत भूख लग रही है, कर्ड एक थिन बटर मिल्क बनाइए, उसमें सब्जा सीड्स डालिए, 5 मिनट में फूल जाएगा, एंड देन यू कैन सिप दैट। और वेजिटेबल रायता बना सकते हैं। कर्ड लीजिए, उसको थोड़ा सा पतला कर लीजिए। इन दैट कर्ड वी कैन ऐड सब्जा सीड्स, वी कैन ग्रेट और वी कैन चॉप द cucumber and have that. That will also give you a good satiety value. Salads, fruit in a nighttime salads will be absolutely okay to be consumed अगर हमें भूख।
सैलेड्स में क्या क्या है? मीन्स स्प्राउट्स है?
No, sprouts
No.
are not salad, these are pulses. ठीक है, हम sprouted salad बनाते हैं, sprouts के अंदर vegetables डाल के। Salads is all your vegetables, all the vegetables. It can be radish, it can be beetroot, it can be your mixed vegetables bowl. Anything can be, even the broccoli can be boiled. You can
But
blanch the broccoli, add the
yeah,
lemon and pepper, and you can just toss it and have
only vegetable. Okay, मिक्स वेजिटेबल चल।
yes, mixed vegetable.
ओके ओके, फिर किनोवा का आपने क्या बोला? कंजी क्या है? कंजी क्या बना?
Kanji, or you can get the kombucha in the market. Those who are in Bangalore, I will post the link. You can order from there. It's available. Beetroot, your kanji and the kombucha is available on the big basket also. If you order today, you will get it by tomorrow. If not, then you can make the rasam, you can make the thin buttermilk, absolutely okay. If you can
Okay.
get the kombucha, it's very good because it had because of the fermentation process, it has both the good and the bad bacteria which our body requires. And these bacteria's balance helps in reducing your resistance and reducing all the inflammation what we have and improving the gut sensitivity and insulin sensitivity.
ओके, एक क्विनोवा कितना लेना है पोर्शन? मींस 2
I have
टीस्पून?
mentioned in the plan, ma'am. Please check it. आप check
Okay.
करिए, उसमें
Okay.
लिखा है.
ओके ओके, थैंक यू
Okay? Most welcome.
डन, थैंक यू।
So we have just few minutes left. If you have any doubt, please. Sorry. Reginald, you have some question. Please go ahead.
Hi, I just wanted to know if you can share the PPT what you've shown. Will you be sharing it us, or is it something confidential?
Which PPT? Women's
The
health.
yeah, the guidelines what you were presenting now.
That
Will
is
you
shared in the morning in the premium. Share again with you. So all these guidelines and the diet plans have been below 7. There's a diet plan number 1. If you have any, you are on insulin or have HbA1c above 7, you have to follow diet plan number 2. I'm going with a very simple way of detoxification because I don't want to take risk with your health right now. If we are doing it for the first time, let's experience it. Let's see what all challenges you are facing, and I will drop my email ID. Could be important. If there is any emergency, can drop down the email, can reach out to your coach. And कभी भी लगता है कि बहुत वीकनेस हो रही है, प्लीज टेक एनी ऑफ दी सिंपल शुगर एंड ईट इट. डेट्स खा लीजिए. कभी बहुत ज्यादा घबराहट हो रही है, चेक योर ब्लड शुगर रीडिंग्स. इफ इट इज लो, देन हैव द डेट्स. बट ऐसा नहीं है कि बस थोड़ा बहुत भी लगा तो पेट ग्रम्बल हुआ एंड वी हैड द शुगर. नो, ऐसे नहीं करना है. अगर ब्लड शुगर बहुत नीचे चली जा रही है, which can happen, इसलिए मैंने बोला रात में medications मत लीजिए. Even your have a complications or HbA1c above 7 or not. So avoid the medication so that we don't have any hypoglycemic event. ठीक है? Anyone else have any doubts? So I have to leave now because there is a Yog Nidra session which is going to start now. So I don't want to take more time. Thanks everyone for joining. I will drop my email ID. I think I have explained the entire plan well. So thanks a lot and all the very best for tomorrow. Do it with these.